Hello and welcome to OneTouch. In this short tutorial, we are actually going to chart a note. And so when you first go to your dashboard, you'll see your patient. As you toggle over your patient, you'll see the date and time of that appointment. And as you toggle over it, you can see here that we can start or resume an encounter, look at their chart, or go straight to their demographics. We're just simply going to start an encounter. And you'll be taken directly to your summary sheet. From the summary sheet, we can gather information about their demographics, any clinical alerts that they may have, and you'll see here all of the information with regards to their prior visits. We can access all prior visits, but the system will automatically display the prior 10 of everything. So I can view the prior 10 visits, their medications, their patient forms, their vitals, health maintenance, and allergies. If I need to review a note, what I may do is simply click on the details, and a PDF of that prior note will populate. And from here, I can review this. If I want to view the full H&P, because I'm in the SOAP note right now, you can toggle between the two simply by coming up here on the right, clicking this button, and now I'm looking at the full H&P on this note. If there's information from this note that I need to pull forward into today's visit, simply hit Import and select from the available tabs of that specific visit that you'd like to bring forward. So today we'll bring forward the vitals and maybe my plan section. I'm going to hit OK, and it will let you know that the import was successful. You may also import information from a patient form that they've completed into the HPI. For example, if you have a questionnaire that the patient has completed, I'm going to take a quick look at that, and you want to import whatever this information is into today's note as well. What you may do is simply import, and that too will populate inside the HPI. All right, let's begin. Any information that we pull forward from a prior visit will automatically populate here, and of course we can make our final adjustments based on today's visit. You'll notice here that we have graphs out to the side. We have those there because looking at numbers does not always give a clear and accurate picture of what may be going on. But when we select the graph, what it will do is it will display the prior 10 visits. And so if there's some slight deviation that's been taking place over a period of time, we can quickly assess what that is, and it may cause us to ask a few more questions, perhaps run a few more tests, and provide better patient care. In the chief complaint, what will automatically display over here is whatever condition that the patient shared with the front desk whenever they said they needed to be seen. If you also happen to have pulled in information from the prior visit from the chief complaint, that too would display over here. You'll have the opportunity within the system to select from either the patient's previous complaints from prior visits, as well as selecting from any common complaint macros that you have built into the system. You may also select from the library that is built as you go, and that too will show up over here. As we move to the HPI, you'll see that we have two complaints here, and as I toggle between the two, the information changes. Oftentimes people can think that they've lost data because they put something here and then moved here. Now, if you'd like to consolidate everything onto one note, you may simply come here and move this to no, and everything will be consolidated. But we do have a macro here, and I want to show you how that's working. In order to get the macro to work, simply move to the complaint that has the macro, which will be indicated by a green plus sign, and then simply begin filling in the data. To activate the macro, simply hit the plus, and begin filling in the appropriate information. To begin adding additional information on the note, simply hit Add Additional Text, where you may free type or select from your macros, where you can make any additional modifications before saving. If you happen to be using the Dragon Medical plugin, you may also deploy that, and you'll notice that you've got this little icon here when Dragon is activated within your system, which is an additional subscription that you may apply for. All you need to do is come down and hit the record. And my microphone is not working. We'll actually display or demonstrate the Dragon Medical plugin in a different tutorial. The history and meds and allergies will always be present unless you opt to have them removed from a note. But from here, you can quickly review their medical history, their surgical, social, family histories, and make any additional changes to that simply by coming here and either selecting Reviewed and Reconciled, adding or deleting a specific condition. Same thing with their meds and allergies. Now, oftentimes we're asked if this is the place that we actually create a new prescription. The answer to that question is, while you can, simply by coming and selecting New ERX, most of our providers will take care of it here. The review of systems is also something that you can have the patient complete during the intake process through the patient portal. And you can have the template set up to default to reviewed and negative. And then, as I've indicated, if the patient does have a fever, you'll notice that that box is now unchecked. We have an E&M helper built into the system, which provides guidance for two reasons. One, if you happen to have to report for MITS and macro via CMS, the system is giving guidance for the types of data and the amount of data that's necessary to efficiently and effectively report. But also giving guidance here will also indicate to you what amount of information you need for a level 4 or 5 visit, which will result in a higher reimbursement. As you move to the physical exam, whatever template that you have defaulted the system to load is what will load. However, if you need to change a template based on the type of visit that you have today, you may simply go here to hit change and then select from the appropriate template from your library, and that template will then load. And you can come through and begin charting and doing the things that you need to do. You can add additional information to your note either by selecting your macros from here, or you can shortcut it and have it auto-populate by activating whatever the note is, the shortcut, with a question mark. And it has to be exact. So I'm going to activate one now. This way, or I'm going to simply put a question mark here, CH, and it will pre-populate the data that's associated with that macro. At any time, if you want to see how your note is being built out, simply hit Visit Summary. And you can review the information that you've put in at this point, as well as toggle between the H&P and the SOAP note. Oftentimes we're asked if there's a way of eliminating all of the various sections that are here because they may not apply to this particular note. I would refer you back to a different demonstration where you can set up and customize your workflow from the administration setting. The summary is designed to display all of the elements that reside inside each of these tabs. If you want to remove these tabs or hide them, you need to go to Administration and your Setup under your Encounter Plans. Your point of care is where you will order anything that is within the confines of your practice. So any labs, any radiology, any procedures that you may do. And if you happen to have a form that's built into a procedure, it may be deployed this way. So we're going to excise a nail, an ingrow nail. I'm going to open up that particular order, and you'll notice that there is a form associated with this particular procedure. So this could be a checklist, a questionnaire, a tech lab flow sheet, whatever that may be. Once that technician or that provider completes this information, they would simply go up here and mark the status as completed. Your results tab is where information for your labs and diagnostics will come in. It will default to any labs that you do internally. If you have labs coming in from outside, say like Quest or LabCorp, those are going to show here. Occasionally you're going to have labs that will just fax over the results, and that information will be displayed here. All of this information is being captured from within the patient chart. You would not add new information here. If you need to add lab information coming from an outside source, again, you're going to do that from within inside the patient's chart. Your assessment is where you're going to begin building out your diagnosis code, or your diagnosis rather. And again, you can select a diagnosis either by putting in the J code or simply by coming in here and typing up what the condition is, and then selecting from the appropriate diagnosis. You may also build out a list of favorites or go-to diagnoses that you work with on a regular basis. This section tells me why I'm seeing this patient today. This section tells me all the reasons I've seen them in the past. And if I'm working with them for something chronic or ongoing, I can add that here. Once you've selected a diagnosis from here, here, or there, it will display here. If you've selected a diagnosis for the very first time, but it is something that you're going to want to employ at some point in the future, you can save it to your favorites list by simply clicking the button, and it will add it here. Everything in your favorites is in alphabetical order. If it's something chronic or ongoing, you can add it to a problems list here. You may also remove a diagnosis simply by clicking this, or you can change the order of your diagnosis for your plan section by using the up or down keys. You must have at least one diagnosis in your assessment in order to open up your plan. Once inside your plan, you'll notice your diagnosis is over here. You'll notice that I have a plan for this diagnosis, and as I move to this diagnosis, you'll see I have a new plan for this one. When I'm ready to order labs from outside, I would just simply hit select labs, select my lab, add the order, add a new test, and select from my compendium. I want to run a CDC, fill in any associated data, and hit save. It will then build out a label. With all of my information, and from here I can either print this or I can print and send it electronically to the lab if we have a direct interface, or I may save this for later. You can also do the same for any radiology, any outside procedures, and then when I'm ready to add to my prescriptions, I can select a refill from their existing list, or I can come and begin building out a new signature, or a new SIG rather, simply by typing in what it is that I need. If I begin typing in what I'm looking for, you'll see it populate down here. I'm going to select amoxicillin. If there's an associated warning from the manufacturer, that will display, as well as any generic brands that I can select from or go ahead and keep my current drug. If I want to select a generic brand, I just select this one. I'm going to acknowledge that, and I can then continue to build out my SIG. Now, many times we're told that certain pharmacies need SIG information a very specific way. If you have a drug that you regularly prescribe and you need to make changes, just variations of it, my recommendation is that you create a macro and then simply come down here and select the appropriate macro to use as part of your SIG builder, and then finish it out. And then any additional notes. If you need to add a controlled substance and you don't yet have a controlled substance subscription, contact OneTouch support at 800-418-6824, option 1, and we'll be happy to send you over information about that specific type of e-prescribing. For our new clients that are using our free plans, there is what they're set up on is what we call a basic e-prescribing plan. What that'll allow you to do is submit one drug at a time, simply by hitting add to queue and then submit to queue. Advanced ERX would allow you to add to the queue, come and add an additional drug, add that to the queue, and then submit everything to the pharmacy at one time. If you have any referrals that you need to get information back to, we can simply add that here. I can open this up and it opens up with tantamount to a fax cover sheet. I can select what pieces of information I want to send back to Dr. Jones, and I can either fax it if I'm using the internal e-fax, or I can go ahead and print this and have it delivered. For those people that do have to report to MIPS and MACRA, using this function will not appease the HIE measure for MIPS and MACRA. What you would have to do is use what we call direct secured messaging. And again, for more information about that, please reach out to support at OneTouch or sales at OneTouch. Any final advice or instructions? Again, it'll automatically pull in information based on the diagnosis, but we're tied into Medline Plus, which is a lot like WebMD. And in cases like that, what you would probably want to do is enter information that is relative to the condition itself. I just typed in something related to skin, and I can just put this information and insert this into the patient education. And add any final notes, either a free type, dictate, or by macro. And then we're ready to give this to the patient summary. If we need to schedule a follow-up visit with the patient, I'd simply indicate when I want to see them, any final notes, and print the patient summary. And this is what we would provide with our patients. The information that we just entered in there through Medline Plus is right here. And if they wanted to then see that, all they would need to do is just simply click on the hyperlink, and it would take them right to that information. From here, we can either print this out and provide it to the patient at the front desk, or we can save it and put it in their patient portal for them to review later. If they require a health maintenance plan or something needs to be updated, you just simply select the plan that you need to, make any final adjustments, and you're good to go. Then move to your super bill. It will keep track of the date and time of the encounter. If you need to change the actual date or the time of the encounter, simply click on this, a calendar will open, and you can move it to the appropriate date and time. Select your service level. If you need to add any additional services, click the advanced key and select from the list of services. You'll also notice that it keeps track of the time that you're actually in the encounter. It's not, however, uncommon for a busy practitioner at the end of the day, because they are going back and reviewing their note, for this to say 10 hours and 47 minutes. If that's the case, simply highlight that and move it back to 0 or the appropriate time. It is critical that you add a service level here, otherwise you will not be able to bill insurance. Here's your diagnoses, any point of care items that you may have added, any outside labs and prescriptions that you may have written, along with any follow-up information. You may then put any final comments to the notes. If you need to forward this summary to somebody within your practice, simply come here and forward it to whomever you need to. If you need to forward it to a supervising provider, simply come here and select, again, whoever you need to send that to. If you are the provider and you do not require somebody else's authority or authorization on the note, you can simply put in your provider PIN and close the note. If we've forgotten to do something, it's going to tell us over here, but in this case, it's completed. Encounter has been closed, and changes are allowed unless you're a practice admin or have authority to unlock the note to make additional changes. From here, we can go back to the super bill, open up the super bill to review it, and now we can review that note. There's our patient information, our practice information, our note information, our payer information, and all the associated information that the payer is going to need or your biller is going to need. And then you're done. This video tutorial is concluded. We thank you for using OneTouch. If you have any additional questions, please reach out to support or contact your sales professional at 1-800-418-6824, option 2.